Hi, I'm Dr. Micah Smith with Orthopedics Northeast. Today I'm going to talk about lumbar fusions. Now, the traditional way of doing a lumbar fusion still works really, really well. And the whole premise of it is to go in and remove the pressure off the nerves and then stabilize the spine. And so traditionally, we go in and we kind of peel the muscles off the back of the spine and then do all of our work. But recently we have some newer techniques that are able to get you to a quicker recovery. Kind of my first less invasive technique is still going into the middle and peeling the muscles off the back, but we don't do it as much. And we basically only do as much muscle disruption as like a discectomy or decompression. And so we can go in, do the work around the nerves, and then still put the screws and rods in and stabilize everything. And people are able to still go home the same day sometimes. Another less invasive way is that where we actually go in through your side, and we go in and we kind of split the hip flexor muscle, and then we're able to take the disc material out. And then we put in what we call a cage, which is basically just an empty box that we fill with bone graft. And it takes a disc that is kind of really collapsed down like this, meaning then the nerves have a space that's very small, and it jacks that space open for the nerves. It makes the nerves happy and free. And so when we put the cage in, it makes the nerves happy, but then we still have to stabilize the spine. And so through some small incisions in the back, we go in and put the screws in under x-ray guidance. And that allows for much less muscle disruption and a quicker recovery for you. And most of these people are able to go home the next day. And then my kind of third and the really cool kind of super minimally invasive option is where we actually go in and we still put the screws in under small incisions under x-ray guidance. However, where we put the cage in, we actually do it through a 1 centimeter incision. So it's about the width of my finger. And we're able to go in and dilate the tissues and take the disc material out. And then we deploy this cage that then jacks everything open and creates that space for the nerves. So through an incision about this big, we do a lot of work. And there's such less disruption of the muscle and all the other tissues that people go home the same day often. Can you imagine having a lumbar fusion and going home and sleeping in the comfort of your own bed that same evening? These are just some of the amazing technological advances that we're doing at Orthopedics Northeast. So if you have any issues with your back, any pain, numbness, tingling going down your legs, come in and see us and see if you're a candidate for any of these.